I have always been heavy. I've always been the fat kid. I've always been the butt of jokes.
It's very difficult. It's very lonely. It's very challenging physically and emotionally.
I mean, it was a gradual, slow death for me.
I was already more than 100 pounds overweight as a young adult.
There's a lot of different moments in life where you just know something's wrong and you have to do something.
If I didn't do anything, I was going to die.
I was in, I'd say the 4th or 5th grade, and the nurse called us into the office, and she said that I needed to take part in a program for nutritional education. And when we got to the classroom, I realized that everybody there was very heavy, if not downright fat. My weight problem got increasingly worse as time went on. I was depressed for almost 2 years and rarely left the house during those 2 years. I decided that I was going to do something serious when the doctor told me that in addition to oral medications to control my diabetes, I needed to start taking insulin. At that point, I decided, no, I can't go this way.
We understand that making the decision to undergo gastric bypass surgery isn't easy. We also understand that bariatric surgery will change your life. It may even save your life. In Dr. Alan Wittgrove, you'll find unmatched experience and expertise.
One of the reasons I chose Wittgrove Bariatric Center is because Dr. Wittgrove is a pioneer in his field. He has over 5,000 surgeries under his belt. And to me, that's a great track record.
Located on the campus of Scripps Memorial Hospital, La Jolla, the Wittgrove Bariatric Center is partnered with one of the premier medical centers in Southern California. A long-standing San Diego institution, Scripps La Jolla is deeply rooted in a rich history of service, tradition, and a dedication to excellence in healthcare. Certified by the American Society for Bariatric Surgery as a center of excellence, our program provides patients with the highest quality of care possible. Our team takes great pride in living up to our reputation.
From the very beginning, it was obvious that Wittgrove Bariatric Center takes the concept of helping people who are overweight or morbidly obese to become more normalized. This is their mission in life, and it comes through. They care about you. They help you. They make you know that they care. And that, in turn, helps you care about yourself.
We've followed our patients very well. We've studied our results so that we know that the operation works not only in the short term, but it works on the long term.
As a center of excellence, we strive to deliver the highest level of patient care possible. This surgery is minimally invasive, resulting in less pain and a faster recovery. The procedure involves dividing the small intestine and bringing a portion of it up to create a very small stomach pouch.
So now people feel different about food. Now their satisfaction is different, their turn-off of hunger is different, and even their fullness is different, obviously, because it's a very small pouch.
Surgery of any kind comes with risk. Complications are always a possibility. Our patients know this. They also know our outstanding track record.
I've looked at my first 1,000 cases, for example, done laparoscopically for complications, and the risk for reoperation for a leak is less than 1%.
The feelings that I've carried with me about being overweight have been shame, embarrassment, feeling unhealthy. Well, obviously I tried every diet possible, but they would either work and I would regain the weight and then some, or they wouldn't work at all. So I knew that bariatric surgery was really my only way out. I decided on Dr. Wittgrove because I had done research for months and months and months on surgeons from Vermont to San Diego to Seattle to Florida, and the Wittgrove Bariatric Center showed to me the lowest amount of complications, the highest center of excellence that I can find with a fitness coordinator, psychologist on board, excellent staff. Every time I called and had a question, they were right there. They were incredible from start to finish and continue to be.
Weight loss surgery is a powerful tool, but it's only the first step. We believe in giving our patients a comprehensive program, a true partnership for life.
The disease of morbid obesity is a multifactorial disease. It has genetics, it has environmental factors, it has some psychological factors. There's no question it's varied. And so in order to get the best results from the operation, you need to have a multidisciplinary team taking care of that patient.
Our monthly support groups are an integral part of our program, giving our patients the opportunity to talk and be listened to. Following surgery, our exercise coordinator helps tailor your individual workout plan, while our team provides nutritional support specifically for you.
I love myself and who I am now. I'm so happy. I think people around me are happier. My friends and family are certainly happier.
It was bad, and you wake up at night, your heart is racing, you're sweating, you're out of breath, your head hurts. They said we've diagnosed you with severe sleep apnea. They says, well, that means you have to go on a CPAP machine. Here I'm this athlete can run all day. I run in 110-degree weather on a football field and run all day. I can't even walk 50 yards without getting tired. I mean, something's wrong there. I'm a ticking time bomb. That's what I said to myself.
Our patients lose weight, but most importantly, they gain health. Within days of surgery, more than 85% of our patients with diabetes find they no longer have the disease. Similarly, more than 75% of people who suffer with hypertension and sleep apnea are symptom-free after surgery.
I was official diabetic the day before the surgery. Now that's all gone. And I breathe much better. I'm real happy. I mean, I feel like I can go out there and run a 100-yard kickoff return like I used to do. I mean, it's great.
The philosophy here is one of total healing. At the end of the day, if I can make somebody not diabetic, not sleep apneic, not hypertensive, and to allow somebody who's been trying for years to get pregnant, that's a pretty good feeling.
At Wittgrove Bariatric Center at Scripps La Jolla, our passion is your good health.
To me, it's like scoring a touchdown, winning the Super Bowl, winning the Rose Bowl, national championship. You know, I look forward to getting up every day now.
I'm extremely grateful to Dr. Wittgrove and his team. They've changed my life. They continue to do so. You're a patient for life with them.
More than anything else, I feel like I can live my life with ease, with actually some grace and maybe even some elegance. I feel like I can contribute to the world. I've not only benefited, I hope that I can tell people about Wittgrove Bariatric Center and that they can benefit from this. I just feel like I've received so much from them. I want to be able to share it with other people.